While you may not find McDreamy in this medical facility, but you will find state-of-the-art equipment and simulators that can do just about everything but stand up and leave the building. You can see when you walk into the lobby that this facility is dedicated to Dr. Speir, and Senior Vice President Dr. Marilyn Four remembers why.
Dr. Speir was a local radiologist. He was connected with the college by virtue of our students completing their clinical rotations in hospitals and various sites throughout Horry and Georgetown counties. He was a champion of this program, and the students loved him. He was well connected with all the medical profession. He had an untimely demise, and his family knew that he would want to give back to the college, and so with their gracious gift they donated significant funds to the college towards the renovation of the building, and therefore the building was named in his memory. We were able to acquire the funding to make the purchase of equipment that is, if you will, the cliche, the state-of-the-art.
State-of-the-art equipment starts with the EMT program, as we watch these students learn how to resuscitate a patient under instructor Chris Blaine's guidance.
Lift the epiglottis up, keep your forearm on his forehead, lift the jaw up and slide it right through the vocal cords. Okay, if you think you're there, good. Lay it down, pull the stylet out, inflate the cuff, remove the syringe, attach the BDM, and let's see how we did.
Here we go.
Great! You got it.
Yay.
Now it's time to perfect it.
My next stop was upstairs to check out the radiography program. And talk about state-of-the-art. I asked the instructor, Mary Stinger, for more information.
That behind the leaded wall is where the x-rays are generated. So once we're done with the patient positioning, we go in behind the wall and we take the x-ray, produce the x-rays, and then we take the image. And this is all computerized. Everything is computerized now. We have no more film. All of our sites have gone to digital or computerized radiography. And this is our digital machine, which is brand new since we made the move over here. It's a brand new digital, top-of-the-line technology.
After they took the x-rays, they showed me what they look for.
Medial malleolus of the right foot.
Mandy Hyatt is doing her clinicals at Conway Hospital and thinks it's the best place to be.
There's so many students are assigned to each area hospital, local hospital, and we go in and we work along and we learn. It's the best way for us to learn. One of the best ways for us to learn is to actually get in and be with the patients and work with the techs.
Andrea Davis is at Loris Hospital for her clinical training, and she told me why she chose this program.
Well, I've been going to tech since I got out of high school, and I kind of went into the different fields. I wasn't sure what I wanted to do first, and once I went to observe, I kind of felt like x-ray would be more of my situation because I wanted hands-on with patients.
Department Chair Becky Miller cautioned students to check into things before they register.
One of the things I ask people to do is make sure you do your homework. There is so much information that you can get out there on the internet before you come into a program that there's no reason for a student not to really understand what's going to happen. It's not just that we're going to put a hand down and take an x-ray of it. They need to be involved in everything, and the reason they would get to go to a morgue or at the time get to go down there is because sometimes after an accident, technologists actually have to go down and take x-rays of that body part or of a particular area that they're looking at. So yes, a student would have to go down and actually most students should try to get a chance to go down to the morgue at some time because it's just something that's entirely different. It doesn't happen that often, but if we don't at least have some of our students subjected to that, then what's going to happen when they're on night by themselves and somebody comes in and they're called down to the morgue? I mean, it just can't be a surprise to them. They have to understand that what they are learning is very far-reaching. Not everything they do is just in their department. They go to the OR, they go to the ER, they go to patients' rooms with portable x-ray units. It's a lot of hands-on. It's a very high-tech and it's very hands-on.
I decided to take a look at the virtual hospital. Can you hear that moaning?
I don't know. It's really bad. Oh.
Nursing Department Chair Christy Seminary told me that they're expecting 5 more simulators and will soon be able to handle a virtual family accident.
We want to develop it so that in the future we can have our EMT or paramedics will go out and bring in the patient like a car wreck. They're going to bring an adult, pregnant lady, a dad, and a child. They're going to bring it to the emergency room where the nursing department will take over, do their initial assessment. They may have to send the father to Surg Tech for a femur, a broken leg. We may have to send the maternal lady to the ultrasound radiology department to have an ultrasound to see if her baby is all right. We then would have to transfer these patients to the floor, the virtual hospital that you were in earlier, to be taken care of from an MVA, what problems they have. We may even have the woman may have to go into premature labor because of the stress from the car accident. We can have our phlebotomy students come in and draw the blood. We can have our health information students come in to take the information and put it in the computers. We really look to, as we grow and as we become more experienced with all this technology, having our students understand the real world of healthcare, which is not your individual program, but all programs working together to provide that utmost patient care.
As I was leaving the building, I noticed these students, and I just had to check them out.
And you're going to feel those respirations. Okay, you're using these stuff. This is what we're going to be doing. Don't forget, next semester, you're going to be living in here every morning.
I asked Program Director Larry Kopelman what they were doing.
The scope and breadth of physical therapy is enormous. We deal with every phase of medicine, orthopedics, neuro, special women's issues. We deal in general medicine with diabetics, peripheral neuropathy, certainly post-operatively and even pre-operatively for all kinds of injuries. We deal with amputees. We deal with wellness as well in terms of preventive medicine. So there's a great deal of information they get in these 5 semesters.
Overseeing this allied health facility is Dr. Philip Render, and he left a 20-year practice in Surfside Beach to join the team.
I came on board with Horry Georgetown Tech the 1st of August of '08, and actually I attended the dedication of the Speir facility in July of '08 and was literally flabbergasted by the state-of-the-art technology Horry Georgetown Tech has been able to put together with regard to their allied health.
Soon this building will have a 20,000 square foot addition through the generosity of the Myrtle Beach Redevelopment Authority. And Dr. Render feels that this will enable them to provide the students with a different kind of training.
Presently, all allied health programs are located in the Speir facility except for one, and that is the dental science department. What we've been able to obtain, really through the generosity and foresight of the Myrtle Beach Redevelopment Authority, is a grant, a $3 million grant toward building or expanding our facility here at Speir. And what we hope to do there is to provide a hands-on clinic, hopefully with residents and volunteer dentists from the area and the medical university, to provide a children's and indigent care facility. What we want to do is close the educational loop by having hands-on practicing dentists and residents here, also treating the needs of the community at the same time. So we'll close the loop on our teaching circle and provide hands-on training in this facility without our students having to travel all over the county for their practical experience. Well, with our fields of study in allied health, it will cater not only just to the retired population, but also an expanding workforce will provide employment opportunities for our graduates and really be at the tip of the spear with regard to economic development too. So the two go hand in hand, our focus on allied health with increased job opportunities for our graduates.
For TechKNOW, I'm Genna Patterson.